Hi everyone, welcome back. Today we're joined by David Flood, President of Intermountain Healthcare Foundation, to talk about how you can lend a hand during COVID-19 and help out our communities during this time. David, thank you so much for joining us. We really appreciate it.
It's great to be here, Amanda. Thanks.
So, as a leader at Intermountain Healthcare that works with philanthropy-minded individuals and generous people, what is the most striking thing to you since this has all happened and started with COVID-19?
Well, I tell you, I came here from New Jersey about 7 years ago, and it's a state that's very philanthropic. Mm-hmm. I knew that I was coming to a state that is known as the most philanthropic state in the country. In coming here, it became evident early on that folks really wanted to help, but I've seen nothing like I've seen over this COVID-19 environment. We've had such a proactive spirit, a wonderful spirit of people wanting to help, just a general authenticity of folks who feel a generational duty to say, this is my time to step up and do what I'm here to do. And I've seen that both within Intermountain Healthcare and outside the orbit around us. It's just been inspiring and wonderful.
And why do you feel like people are so inspired to give right now? What makes this different than other things that we've gone through throughout the years? Well,
clearly, this is the most menacing health crisis our world has faced in this generation. So people are looking at this differently, and I think it's surfacing emotions that I know we have as humans, but also that Americans have proven to have over time. Since 1960, as they've looked at philanthropy, they've seen that in difficult times, in very good times, people give, and that makes sense to folks. In difficult times, Americans really rally. Mm-hmm. They step up in a big way. And we've seen that here in Utah in a very unique way. We've learned from the examples in New York and New Jersey and on the West Coast as well, in California, where we want to get past and get through this in a better way. Now that we have time to invest in this issue, we have people who are stepping forward and saying, what can I do? It's very innate to us, and this has uncorked a great passion for wanting to help.
You brought up a lot about people wanting to help right now, especially because they have more time. Either they're working from home or maybe they're unemployed at this time. And a lot of my friends really have the need to want to jump in and be really hands-on with the community, specifically in healthcare, but that requirement of social distancing kind of doesn't lend well to volunteering at a hospital in person or going to the food bank and helping out there. So what sort of effect can giving have right now that's a little bit different than just being in person? What types of things can people be involved with?
Well, we've got a lot of things going on, and you'd be amazed what folks have offered to help with. Certainly folks are writing checks to our Rapid Response Fund, and I can talk about that, and that's just been wonderful. But there are a lot of ways to get involved. Folks have gotten involved by donating plasma, as there are FDA protocols that are underway right now, and folks want to help and be part of that. So we have that happening right now. We have folks who are volunteering for our Project Protect. For those who are not familiar with Project Protect, this is a galvanization and mobilization of legions of volunteers, 10,000 mm-hmm. volunteers who have gotten together to help us create personal protective equipment, PPE. And that's going to include 5 million masks, 50,000 isolation gowns, and 15,000 face shields. And we're talking about 10,000 volunteers a week. Just incredible. So folks can get involved in that way. Folks get involved by simply writing a note. We have on our Rapid Response page, you have the opportunity to go in and write a note to our caregivers and show your support. There are countless ways. People have shown up with food, and we're trying to deter that a little bit, only because there are so many rules around it. Mm-hmm. But I've also had somebody who just offered to bring beer over for folks. Now, I couldn't accept that, but I want you to know that it's coming in all forms. So a lot of ways people can help. And we've also had offers of a number of different things that we've not been able to accept yet. We've had moving services, people with moving trucks who want to help us out. It runs the gambit. It's just been incredible.
You mentioned Project Protect, which I think is really important. We have already made 1 million masks in the last week, and we had our second pickup yesterday for the remaining 4 million masks we hope to make. And I think that's a really great opportunity for someone to get involved who has more time on their hands right now, or can't necessarily give a money donation to us, but actually wants to help somewhere else, it's really great. All those masks and isolation gowns are going to healthcare communities, not just Intermountain Healthcare, but also to the University of Utah. So it's a really great way to get involved with the community. And you also mentioned the Rapid Response Fund. Can you talk a little bit about what that is specifically, just so people have a better idea of what they're donating to for that?
Sure. There are a whole bunch of needs that are surfacing as this virus approaches us, and we want to be prepared. We want to educate our community, and we want to respond properly. There are supplies that we're looking to purchase that were unexpected. There are needs surfacing every day. Today I received a call saying we could really use in our hospitals iPads. These patients, they're alone. They can't have people visiting them. So we want to make sure we can create that human contact. Again, taking advantage of the time we have as compared to some of the other locales who have been hit with this surge already. So there are a number of opportunities for folks to fund us through the Rapid Response Fund. We also have equipment needs as we begin to bring beds online for the surge as we go in each of our facilities. We're going to need more equipment as we go. So a whole lot of things are happening in that Rapid Response Fund. I also want to mention some of the research protocols that are happening. We have 2 clinical research trials that are underway, and we are going to provide some funds out of the Intermountain Foundation to accelerate those studies. Hopefully we'll have some reports back in the next 4 to 6 months, and that'll allow us to be in a better place should we have a second surge. So we want to be ready for everything. So it's research, it's supplies, it's equipment, and a lot of things that'll come up as we go.
Can you explain a little bit about what the foundation does outside of COVID-19 and looking to the future of getting our community involved with the foundation and donations? What are some other types of things that the foundation is involved with that people could get involved with outside of the time right now?
Sure. The foundation is designed to bring value add here to the healthcare experience at Intermountain Healthcare. Intermountain Healthcare is a model health system. One of the reasons that I came here from New Jersey was to come here and be part of something that's very special, and others will emulate what we do. So the foundation will get behind certain programs or a number of programs to help bring them to life in a different way. We may purchase technologies, we may get into research, patient-friendly capital enhancements to our campuses. Right now, our main project that we've been working on right up until COVID hit us, and we have respectfully sort of delayed that activity, was the construction and the mobilization of the model system for the delivery of healthcare to children. We are going to, we put a stake in the ground to say that's what we want to be, playing off the traditions of Primary Children's Hospital and much beloved centerpiece here in our community. And we have the opportunity to really touch a whole lot of lives. So we're running a campaign shortly or we're in the midst of building a campaign to make sure that we can fund the ambitions that are there, which will include a second Primary Children's Hospital down in Lehigh, and we're really excited about that.
Yeah, I think that'll be great for the community. I know that there's some construction, I do believe, happening right now on that, so that's exciting for the future. Can you talk a little bit about what are some ways that people can get involved, maybe that are on the smaller side but still make a huge impact? You mentioned writing our caregivers letters. What are some other ways that people can really get involved to show that the community that they're thinking of them during this time?
Sure. First, I don't want anyone to think that the foundation is just about the large dollars that come in. We have thousands, tens of thousands of donors. They all contribute, and therefore they all own a piece of us and a piece of our mission. So they're part of our family. But beyond the dollars, which again are very helpful to us, we also want to be able to call on folks for various social needs we'll have, political needs we'll have. We'll want to get folks involved in acknowledging our caregivers and helping us to message to them, to get information out, particularly during, on our campaigns as we have them, but right now, critical that our folks who are involved with the foundation will help to bring information out. Intermountain Healthcare has put out some great information about how to prepare, what to do if someone gets sick. That information all needs to be disseminated throughout our community, and I think our foundation folks are devoted, wonderful contributors and those who volunteer with us through Festival of Trees and Pennies by the Inch, that all of them are helping to get our messaging out to folks. That's how we're going to help people with the time that we have.
So if you see something that's interesting to you on social or a news article that talks about how to get involved with the community, disseminating that information to people is a way to get involved without having to take a lot of your time, but it's still a great way to show the community what we're doing. Yeah. I know that the letters to the caregivers is something we're going to be launching later today. We've gotten a ton back, which is really great, and we're going to be showcasing those to the community, which is nice.
And the thing to also, if I can mention, the word philanthropy in and of itself means love of humanity. And Intermountain's mission is to help people live the healthiest lives possible. So it may not even be something within our walls or having to do with necessarily bringing any benefit back to Intermountain other than helping the community. We want to keep community vibrant. And that's really what our goal is. So it might be going next door and bringing a mask to your neighbor who you think might not have one. That's helping to keep the community vibrant, and that's what we want to be. We don't want Intermountain to be known as a place that just fixes you when you're broken. It's so much more depth and dimension to that than that.
Yeah, the cloth face mask covering that you're talking about too, Intermountain is also accepting those, which I think is important. Project Protect has two different parts. There's the clinical masks that we're giving to healthcare workers, and then the cloth face masks that are going to the community. And also patients who are coming to our facilities. And as a community member, you can get involved, you can donate. There's a bunch of different locations that are taking them right now. And I'll make sure that that website comes up so you guys can see it. But David, is there anything else that you kind of wanted to mention about philanthropy, the foundation, and how people can get involved within the community?
Yeah, I would just ask them to stay close to us, to look at the website, help us to spread the word. We've taken a position in our foundation that we know there are a lot of needs in the community at this time. So we've not broadcast ourselves out there in any way to interfere with other needs that are out there right now and are being pronounced right now. But we do want folks to know that we want to be a bridge for you, for that innate feeling we have where we want to help people, particularly during a time of crisis. We want to be the bridge for you to that. We think, we have the opportunity to touch more lives than anyone else in the Intermountain West, and we want to take advantage of that for you to make sure that we are taking your finite philanthropic dollar and touching more lives than anyone else, making it go the furthest. So please stay close, be part of us, whether it's dollars or it's word of mouth or it's volunteerism. Please just be part of our family and know how grateful we are that you've chosen to do that in any way that you've decided is right for you.
Well, David, thank you so much for joining us. We really appreciate it. And that website that we were talking about, that lists all the different resources, is intermountainhealthcare.org/together. There's a couple different places on there. It talks about the donation locations for our homemade mask coverings. It talks a little bit about Project Protect, that rapid response fund, and how you can get involved during this time. If you're wanting to know a little bit more about the symptoms that you could be having related to COVID-19, you can also still call our COVID-19 hotline at 844-442-5224. We also have an emotional health relief hotline available to the community 7 days a week from 10 a.m. to 10 p.m. And that phone number is 833-442-2211. Thank you so much, everyone. We'll talk to you next time.